Inspiring Uganda.
A very good evening to you who is watching You Health Chat. My name is Sophie Matovu. It's always a pleasure to have you join into the show and be able to discover a lot as far as your health is concerned. Today, we have a special edition, and we are just calling it Matters of Health with experts from Humanity First UK. These are professional doctors back there, but they do come down once in a while, not only to Uganda, but across the world to be able to support us as far as our health is concerned. I'm going to allow the doctors to introduce themselves, then we'll dive into the topics or areas based on their expertise, because they have been in Uganda for quite a number of days, and they held a very big health camp in the eastern region where they were able to discover and see a lot of health challenges. Doctors, a very good evening to you.
Hello, thank you very much for having us on the programme. Yeah, my name's Dr. Ehsan Ahmed. So I'm currently a hospital doctor in the UK, and I've got a special interest in renal medicine and sports medicine.
Wow, interesting. And doctor?
Thank you for having me. My name is Mazhar Warich. I'm a trainee in cardiology working in the UK, and I'm here with Humanity First Uganda to support the Uganda team.
Okay. Now, I would like to start with, because, you know, I never take it for granted that everybody knows what it is, but I know one of the big drives that you have as Humanity First is what you're calling global health. I'd like you to explain very briefly about what it is.
Sure. So global health is just one of the many pillars that Humanity First has. The other kind of pillars they have is, you know, water for life, education, you know, really empowering, you know, different situations. But global health focuses on all types of health within Uganda. We've had medical camps, we've had education within schools, and we've also kind of empowering, you know, medical professionals to help give them some training so that they can bring back all of their knowledge wherever they're working.
Mm-hmm.
Yes, doctor?
So Humanity First was initially established in the UK in 1995, and it was very small beginnings after the Bosnian War, where initially started as a disaster relief charity, where a small group number of people went to Bosnia to support the disaster and help the people there. And then from then, as Dr. Sabah said, that small different streams started. So from disaster relief, we've got the global health, we've got education for life, water for life, orphanage. We support orphanages, and there's a number of orphanages in Uganda that Humanity First supports. In addition, gift for life. So Humanity First is operating in 55 countries as a charity to support the people where the support is needed. Mm-hmm. So it's a privilege to be here in Uganda to support the people here.
Now, I'd like us to dive straight into what your experience was like, or what your overall view was when you went into the Eastern region. As a cardiologist, how bad was it when you were at the health camp and you had to see thousands of patients with different, you know, conditions?
I think one of the things that, so this is my second time that I've come to Uganda, and previously we held our camp in Mbale. This time we were in Budaka region, in the District Health Centre 4. And essentially, the patients who came to us had hardly ever seen a health clinician. They didn't know what medications they were on or what their treatment they had. Most of the patients were farmers. So they didn't have as much education about the health, which I think was one of the most important parts of what I did. So trying to educate people that this is a condition. So for example, we talked a lot, saw patients with hypertension, talked a lot about hypertension, why it's a chronic condition, and as we progress in modern medicine, what we're trying to do is prevent major problems happening in the future. So with hypertension, preventing major strokes, heart attacks, kidney disease, problems with blood vessels to the legs, things like dementia, and just educating them that we're trying to sort of buy a better future for their health, essentially, by controlling the blood pressure. And essentially, one of the important things with hypertension, of course, is not just the medication that we use, but also simple things like exercise, controlling the diet, controlling how much salt you take, and also stress. And of course, when you've got a very busy lifestyle, there can be lots of stresses coming from different directions, and understanding them and trying to look at them it certainly has a big impact on hypertension and control.
Mm-hmm. When you talk about the medicines, you know, of course, medicine is evolving and new drugs come on. But one thing I would say that I've noticed, according to the medicines, I think with the new regimens that come on, the cost is a little bit higher. For the medicines that you have seen, because it is sad when you say that some people could not even identify what kind of medicines they are taking. For them, it's just that I know I take this medicine, full stop. What's your overall view about it?
For hypertension, there's many drugs that are very effective and very cheap. And not just identifying the drugs, I think, because a number of the clients that we saw weren't able to afford the medication, so they would come and to the camp, because fortunately we were able to give out medicines for free. They would be able to get those medicines for a few weeks. But hypertension's a lifelong condition. If you control all the other sort of non-medical problems and you still have hypertension, we know that major diseases could be prevented in the future if we control it with the medicines. In terms of the medicines themselves, there's a number of medicines that are very easily available and very cheap that control, and there's a number of different types of medicines. So there are new drugs within those same classes, but the older drugs that are very cheap to make are available.
Another kind of misconception that we found, especially with like hypertension and with the drugs, is sometimes with antibiotics they're on a course. You have it for 10 days, 5 days, and then you can stop the course when the infection is resolved. So sometimes we'll speak with the patients, and the patients will say, yeah, I was given these antihypertensive drugs and I've completed 10 days. I completed 2 weeks. But what they don't realize is that this drug is actually there for life, you know, until obviously, it's as Dr. Moza said, it's a lifelong disease. Mm-hmm. They need to be having it every single day. So sometimes I think that misconception and that, you know, misunderstanding, that they think that we'll have it for 2 weeks, it'll be okay, and then stop. Exactly. So I think that was, you know, another thing.
I think that's certainly part of it, definitely.
Mm-hmm. Now, with this that you discovered, what is the situation like back at home in the UK when you hold this kind of health camps? Do we share the same challenges, or they are a little bit different?
No, I think it's very similar. What we do as health professionals is education. We have to get the patients and clients on board and sort of take part of that, take hold of their health, and know that actually I can control my health and I can fight for a better healthy future. So a lot of what we do is education in the UK. When I see patients with difficult to control hypertension, I talk about things like how they're getting on with the medications, what side effects they have, and whether we can change how and when they take them to try and control those side effects with the benefit of taking them. So it is very similar in the UK as well.
Absolutely, and I think another important aspect is knowing where these diseases are coming from.
Exactly.
So looking at the root cause, the root problem, and obviously sometimes it can obviously be genetics. Some populations are more likely to have some certain diseases, but another key thing is that sometimes these can be preventable. So knowing these preventable steps, these preventable, risk factors to try and reduce the risk factors to, prevent these from happening is such an important thing. And which is why Dr. Mazza said education is, one of the most important things when it comes to this.
Yeah, I certainly agree. We're now worldwide in the era of non-communicable diseases. So rather than infections, of course there's plenty of that, but diabetes, high blood pressure, heart disease, stroke, those non-communicable diseases are what is affecting the global health, what is comes up as the top few causes of death in the population. So to try and tackle that from an earlier age, to try and have a healthier lifestyle from exercise and diet is what we can, probably the most effective strategy in preventing problems in the long future.
How easy can you say can you register success and say that the health camp was successful? Because I can imagine, yes. How easy was it for the people who came to visit the camp to open up? There are certain times you've had scenarios where somebody will conceal information from the doctors, or at certain times they actually even can't remember if they've been on medication for so long, and we have adherence issues, you're on and off, that they might not be able to give you the sufficient information for you to be able to do proper diagnosis or guide them effectively. How easy was it?
So I found that obviously that's a quite a difficult challenge when it's the language barrier. So what we did this time was we sourced very skilled nurses that knew the language and the dialect of the area. So it's very important to build a rapport with a patient. So when a patient comes in, the first initial impression, they say that the first impression is a lasting impression. So the first impression you make with them is essentially the first time you're making that rapport with a patient. And then the second thing is obviously the history. They will say they have this type of pain, or they say they will have, for example, chest pain, which can sound quite scary. But when we ask the specific questions, ask them to extend the, where's the pain coming from, how long it's lasting, a full kind of history. Medicine and, history is so important. We can then slowly decipher, a certain differentials. And then we can, give our, impression of these are the diagnosis, the differential diagnosis, and be able to really treat them properly. So, of course, there was a challenge trying to get that information out. But I think initially, when we built a good rapport with the patient, they were, opening up. And a key thing is that you have to realize that a lot of the consultations with the doctors, they are going to be confidential. We're not going to, obviously, names are going to be kept, and I think that helps them to understand that if whatever they discuss, if it's going to be confidential and it's just, the doctor-patient relationship, they're more likely to open and tell the truth.
Yeah, I certainly agree. It's a privileged profession where you know that patients come and tell you things that they probably have never told anyone else. And I think it's the same in Uganda as in the UK. And that helps us to decipher what's actually going on. So there's some difficulty in the life going on. That's probably the reason why they're here. So they've got anxiety, they've got palpitations, because they're worried about something. And while they're worried, what's going on is there anything that we can think about that can help them tackle the anxiety that will help with their palpitations? Because medications are not the end and be all of everything. There's a significant impact of how you think is how you feel. That's certainly clear from what I've seen in the past.
Then based on the numbers, so who were the majority? Was it the children? Was it the women? Was it the men? From your
So in this camp specifically that we managed to see, we've managed to actually see over 1,000 patients. So this is from a medical point of view, 1,000 patients. And you know, the ones that I saw, they were a mix. So we've had, you know, luckily, thankfully in this kind of clinic, we had such a good variety of specialities. We had cardiology, we had rheumatology, we had, you know, gynecology. So obviously any kind of woman that had, you know, gynecological problems, they were able to direct. So the actual camp, we started off with the registration, and then there was the triage nurses. So they would get the information why they've come, and they would then triage them to the appropriate person. So then rheumatology, if they had, you know, joints, or, you know, arthritis, or, you know, things that are according to the symptoms, they would then direct them. If they had chest pain, palpitations, they would see, you know, Dr. Mazhar. And then kind of anything that's general, there was, you know, not only did we have our, you know, doctors from the UK, there was also the doctors within, you know, the actual hospital that were giving up their time, volunteering to, you know, help. So if there was any general things. So in my opinion, there was a wide range. You know, obviously different specialities saw a lot more. So obviously the gynecologist saw a lot more female patients, even though he did have, obviously he's got a general, you know, knowledge, but he saw a lot more females. How did you feel?
Yeah, I think in terms of generally, probably a lot more female patients that came generally to the camp. And that's not dissimilar to what we see in the UK. I think men are usually a little bit more blasé about their health, and they put things off, and then they come when things are dire, and then they're like, we need help, and that's when, you know, when a middle-aged man comes even a young man comes into clinic to see a doctor, then you're like, okay, there must be something serious going on, because men don't usually come to see their doctors.
Then for the condition of heart, because heart health has become something that is very major, and then we've seen scenarios where, like, how should I say, it's one of those that people really feel like, now this is it. If I have a heart condition, they rarely believe that it is something that can be managed, and they think they have signed their death sentence.
I certainly disagree with that. In cardiology, it is probably one of the best researched fields in the world, and we have so many treatment strategies, not just medication, to treat the problem. Firstly, to diagnose the problem, we have the most simple tests like ECG, where we can look at the tracing of the heart, electrical activity, which can tell us about problems that may come even 5-10 years before that they manifest physically. Then we've got ultrasound scan of the heart, which is called echocardiogram, then CT scan and MRI scan of the heart to identify what the problem is. And then depending on the problem, there's multiple treatment strategies for things like rhythm problems of the heart. There's medications, there's procedures that can be done to get rid of those sort of causes of the abnormal rhythms, those foci within the heart that are causing abnormal rhythms. Or if there's a problem with the blood flow to the heart, then it could be stents that can be done, or bypass grafts that can be done to help that. But living with a heart condition is something that is often a really important and part of rehabilitation patients back to the normal health. We want to achieve people going back to the normal well-being, feeling well, being able to do the normal activity, especially in the young people, to be able to go back to work, which is essential for their livelihood. That's very important. And gone are the days that you would have a heart attack and there's no treatment. You would just be in hospital for many days. Now, even the simple medications can make such a big impact on the treatment itself when you have a heart attack, and also the recovery phase where the heart is in itself healing. And there's lots of procedures that we can do to help as well.
Absolutely, and I think when Dr. Mazhar said like an ECG, so this is the electrocardiac kind of, it does the electrical imaging of the heart, so it gives a tracing of the electrical activity of the heart. And then in the UK, nearly every single patient that comes to the hospital will have an ECG, and you'll be able to compare it and see how it is. When Dr. Mazhar, visited last his last camp, he realised that there was a need. Something so simple. It's not invasive. You're not taking any blood. It's just some stickers that go in the right place. Within 30 seconds, you've got an ECG reading. So he's actually donated, given as part of the Humanity First, given an ECG machine that actually does an electric version in a hospital in Mbale, one of the hospitals in Mbale. And what it does is it gives an electronic version of it that they can then upload it onto their notes. So it's just, sometimes we see the need for something because it's so simple, and a normal ECG excludes so many different diseases, and that's something that
definitely. I think it's without ECGs, there's no cardiology. I think.
This is true.
So yeah, it's an essential. But going back to your original questions about it is scary to live with a heart condition. But there is so much treatment that can be done, and people do return back to their normal life, albeit they may feel a little bit lethargic. But a lot of what people feel is their physical conditioning. So if you're inactive, you will feel more tired. If you're an active marathon runner and you have a problem with the heart that's fixed, you may go almost back to normal because your body is conditioned to that level of activity, and that's the important thing. That not feeling afraid and having a chat with your doctor about what sort of things that you can do, what activity level you can do after your heart conditions to go back to feeling how you are. It's not a death sentence for sure.
Okay. What plans do you have? Because after pulling off a good medical camp like this, I believe now people in that area start yearning for one. Then the follow-up, there are certain times, I don't know if that happens to you, where you get attached to some of what you have seen there, and you still feel that drive and the pull factor, like for you who's been to Uganda for the second time, and you want to follow up and find out how is it like in this area. Has the health center for where you have been conducting the medical camp upgraded a little bit? Have some of the doctors matched up to that level where they have picked a skill from you a little bit more? And I don't know, what's the plan, the bigger picture?
I think we want to continue, and we certainly want to do more and more, and we want to bring more doctors to help out. But of course, we have to help the clinicians here to get to a level where they are able to look after the population, and they certainly are amazing doctors that we've worked with in the past, who volunteered their time. So I think that we are able to touch the lives of a very small number of people, and those people, it would be amazing to see how they do, but and get feedback from maybe the hospital to see what the impact was. While we were there, actually, interestingly, one of the hospital directors mentioned that from the dental patients who came, that they were able to see patients in the camp were able to see patients in 3 days that they would be able to see in 1 month. So that sort of impact is quite mind-boggling, and I remember seeing some patients that had come from 50 miles away or even more just to attend the camp. So we'd love to go back and see how people are.
Absolutely,
Yeah.
absolutely. I think, of course, this is my first year in the camp, and it's been extraordinary for me. I think every year that the camps are running, they're getting a little bit better and a little bit more improvements, and that's what you would expect with anything. And every year we're hoping to still deliver the best quality medicine, but improvements every year. We can come every year, do a little bit, but we're only treating, a small number of patients. Even though the number is 1,000, it's still a small number of patients. When we empower the locals, when we give the teaching, and when the locals are getting involved, like within the dentistry, they had the local officers, the local dental officers, where there was the dental surgeon, Dr. Osama Riaz, was there supervising them. He could have done all of them, but he didn't. He took a step back. He wanted to empower the locals so that if there's anything that they need, or any kind of, if they're making, not mistakes, but if they're making a bit of a different kind of variation, he can then say, this is the updated version, this is how to do it. So now when we go back, these dental officers, the work still continues. Yeah, they can deliver the quality health that they can. Just on this, another factor is that we've started a virtual clinic. So with some of the hospitals, our gynecologist has made links with the hospital, and now what will happen is that the plan is to deliver some virtual presentations on up-to-date information, once every 3 months. We'll start off with, see how popular it is, whether it's common. Another thing is education, prevention, like you said. So Dr. Osama Riaz is the reason why he's not here at the moment is he's in a school right now, teaching the youngsters the key elements of oral hygiene, the key elements about the type of toothpaste. It should have fluoride in it. Once you brush it, you shouldn't rinse your mouth and spit it out. Like simple things like this is what Dr. Osama Riaz is trying to teach from the young kids. So once they grow up, it would see hopefully a reduction in the number of cavities and the number of extractions. And just so, I know there's so much that was going on, but one more thing is Dr. Mazhar has actually got a virtual ECG clinic. So what happens is the doctors here that where the ECG's been donated, if there's anything, any cases that are quite difficult or any ECGs, Dr. Mazhar is available for an ECG, virtual ECG clinic. So these get sent to him via email. And he's able to interpret this information, give virtual advice. Of course, it's down to the people that are seeing him, examining the patient, but he can then give virtual advice 4,000 miles away, sitting in the UK with his cup of tea, and able to give that important advice that sometimes it's difficult to give. And so I think these little things that are happening, really, we're not here to just come here one day and leave. We want to empower the locals.
Mm-hmm. Now, in terms of what's the best or the worst case scenario you have encountered, not in Uganda, but say globally, because I believe you've traveled different countries, with your expertise. And I believe there's some of those that you look at and you're like, this should never happen to any of the patients in your area. This is how you can counter it. This is how it should be managed.
I think healthcare is a very important resource, and it takes really a long time to build infrastructure to be able to deal with the demand of the population. So when I was last here, I met a number of young children who had very loud murmurs of the heart, and essentially they had already been diagnosed with that they had a hole in the heart, these young children, from a young age. And the mothers were telling me that they'd gone to seek essentially treatment before, but the treatment was too expensive, and actually the country doesn't isn't able to provide the surgery that may be needed for the patient. I think that's something that we don't want, and we want to prevent in the future. So trying to help assist in providing the basic healthcare initially for the patients, and then we want Uganda to progress more and more in the future to be able to provide the healthcare that's needed for all the patients, because health is such an important aspect of life. A good health, as you mentioned before, people are really anxious and they say that their life stops if they get a heart condition. It's such an important for peace of mind, and that's what we want to try and support. And actually, I think things are getting better from the last time I was here. From what I can see, that things are slowly progressing towards a better future.
Absolutely. Yeah, from my experience, obviously, as the first time in Uganda, beautiful country, I find that it's very upsetting that a lot of the cases that we're seeing, and this is all over the world, this isn't just Uganda, a lot of the cases we're seeing and the conditions that they're coming in, they've been suffering for so many years. But a lot of these conditions are preventable with a bit of education. These are preventable diseases that, if they had the education, which is improving now, every year we're seeing, there's more prevention, there's more education on the prevention and reducing the risk factors. And these little things are really, it's upsetting, because you look at sometimes these patients and you feel for them, that they've been living for 3, 4, 5, 6 years in so much pain, or, in conditions where, if they had a little bit more education, and it's seen worldwide. This isn't just a condition, and this isn't just what I see in Uganda. I mean, when I go on, my camps in different countries, I see the same situation. So I think, education and preventative medicine is so important. And one thing that if you allow me, that I would like to share is a form of medication which is absolutely free, but it will help prevent and help reduce the risk factors for some of the diseases. You heard me correct. It's absolutely free. And the medication that I'm referring to is actually exercise. The importance of exercise, physical activity, is paramount. It helps reduce the risk of coronary artery disease, diabetes, falls. It helps reduce falls. It's so good and proven to be so good, scientifically proven, which is why, for example, in the UK, they encourage every single person for 150 hours over a week of exercise. Even if it's 30 minutes a day of exercise, what that does is not only does it help stimulate the heart, it helps, stimulate, everything to help reduce, your blood pressure as well. A bit of exercise it goes a long way, and it's free. You don't have to pay for it. I've seen a lot of the youngsters, they play football. I'm an Arsenal supporter. I've seen some Arsenal supporters here too. It's quite a popular, a strong team. But, these footballs, it's such a good way to, have that 30 minutes of exercise a day. Going for walks. You can put your music on. You can, whatever your vibe you want to go to, you can do that. And in one particular aspect that I've saw within the camp, that I saw, was a lot of lower back pain and kind of leg burning sensation, leg pain, and with that, a lot of it can be quite preventable. A lot of the cases that we saw were farmers. And the positioning, like the posture, keeping the correct posture is such an important aspect. When you're lifting heavy objects, keeping the back straight, knowing the correct way. A lot of them are bending over. There's the farmer's back, and when they return after hours of farming, it's agony. They're crying in pain. And there's a few exercises that can be done. So another thing that we saw was a lot of the cases, they were having a lot of burning. A lot of burning, it's like an electric shock. They were describing it to us, as electric shock. And that sometimes, in the UK, sometimes it's called sciatic. Your sciatic nerve, sciatica. So your sciatic nerve is in fact the longest and widest nerve in the whole body. So what happens is you've got muscles that are helping within inside. So one of the muscles is known as the piriformis muscle. So this muscle goes, it joins from the back of your tailbone, and what it does is that the nerve actually crosses underneath the nerve. So sometimes when you're having these back problems and your positioning is quite bad, this piriformis muscle can get inflamed. This pushes onto the nerve. When you push onto that nerve, that's the symptoms that you're getting. The burning, the restless legs, sometimes you can get that feeling of an electric shock, sometimes you can't walk. And these things can be, prevented. There's a few exercises that can happen that you can do. One of them is if you, for example, lie down flat, get a towel or a cloth, and you're basically putting it around your leg and basically essentially stretching your leg as much as you can, both ways. With these exercises, you should do them, for between 5 to 30 seconds. You should have multiple reps. So let it come back down, do another one. Let it come back down, do another one. So you should have about 10 repetitions of the same exercise. And then you swap the leg. One particular exercise for the actual piriformis muscle is if you cross your leg. So if you're crossing this leg, and the leg that you're crossing, you actually pull it towards your adjacent shoulder, your opposite shoulder. So I'm basically pushing it until until you can feel it, and I can feel it. So yes, absolutely. So I'm holding this now. Okay, nice, taking deep breaths. And then I relax. Give it 5 seconds. Pull, absolutely. Pulling it again. And then repeating it. And once I'm done with this leg,
then you switch to
absolutely. And these simple things like this that can really help. And we were giving these exercises, to the patients, and they were like, "Wow, this is amazing." Sometimes these farmers that do a lot of exercises, ice is a very good. It's very cheap. It can be a bag of frozen vegetables. As long as you don't put it directly on the skin, put it over a towel. Icing when it's quite inflamed, icing can be quite good. In a quite strong point, putting ice over it for the next. For example, if you've had inflammation of it, putting ice on it for about 5 days. So every day, putting some ice on it. That's good in the acute phase. And then in the chronic phase, heat, which this country is famous for, does help. Heat therapy, to be fair, the weather in this country is amazing that you don't need to go to these special clinics for the heat, because in the UK they tend to go to like the saunas, to help relieve the muscles and stretching. But by the grace of God, you've got an amazing country with amazing weather that you set out open sauna.
Now, for us, do you know what they normally do? It was a common practice, and I think some people still do it in the households here. Once they're having lower back issues, they'll get the little one. The one is also heavy, and they tell them to roll over the back, that area.
Yes.
So, which they think is a therapy, but in actual sense, certain times, it's causing more damage, because this is weight you're adding onto maybe the muscle or the vein that is having issues. Now, I would like you to share with me, each one of you, your final message to a person who's watching you right now.
I think the most important thing that I want to say is that everyone has the ability within themselves to take control of their health. And one of the things that I tell my patients is that don't think now. Think about 20, 30 years in the future. Do you want to be having problems with breathing, problems with pain? Try and do something now so that you can buy a better future. I think, and those simple things make the biggest differences.
Okay. And from you.
Yes, absolutely. A lot of the conditions and the diseases we're seeing are preventable. So knowing the right education, knowing the right methods, you are, improving yourself and making your future a better future. The most, the biggest wealth is health. So we need to all take in control our own health, because health is the most important factor, and better than all types of wealth in the world is your own health.
Okay. Thank you so much to the wonderful doctors for your time. And we do really appreciate and look forward to the next time coming along down with you for the health camp. Well, you've heard it all from the doctors. That is Humanity First UK. And trust me, health is wealth, like they say. And they do not only do those, the other things they did not tell you that we didn't have time for, is they have been also in disaster areas where they've been able to save lots of life and support here and there. And most of the times when they're out to support and come out to do things like this, these are things that they do at the time when they take their annual leave. But I don't know what you intend to do with your annual leave, but trust me, they make very good use of it, and they have saved a life or two, lots of lives out there. Would like to say thank you so much. Keep watching UBC TV for the 10 o'clock news is coming your way. Good night.
UBC, inspiring Uganda.
One-on-one with Michael Jordan Lukomwa.
A weekly face-to-face conversation focusing on accountability, inspiration, information, and sensitization of the public from the various sources such as inspirational profiles.
Having a disability is not inability.
Professional guidance.
There is no special antiretroviral therapy that is given specifically for discordant couples.
And of course, politics.
Don't you see anywhere that you would give a credit in the fight against COVID?
My role as the owner of the country is not to, be preoccupied by giving credit to my servant.
We have said that if we are to talk to General Museveni, there must be certain conditions in place.
Is it true that you paid 5 million shillings to MPs that voted for Anita Mong and Tayebo?
That is laughable. Why would we pay when we have nominated them as SEC?
Every party has been represented in Uganda's parliament for 10 years. We only by one MP, you yourself and my daughter, Susan.
Every Friday 9 p.m. it's one-on-one with Michael Jordan Lukomwa on UBC TV, inspiring Uganda.
This weekend on UBC.
Welcome to the new episode of Teens Crown, the best entertainment show around Kampala, around town.
I never want to lose a real one like you.
An affliction is but kidding. Persecution needs more training to win my trust, and death walks pants down and hands up.
Let go. Showtime. Red time.
Buli munya-Uganda nayitinga amakuru marungi. UBC West eyina amakuru marungi kandi agali kwezibwa. Rero za program zayo ziri omu Runyakitara hamwe n'Orufumbira. UBC West eyina tekinologiya ey'omurembe eri kugibasisa kuhika omu bicweka byona omu ihanga nangu n'aheru y'eihanga. Tukwatire aha frequencies zetu. Kisoro 97 katonyeze mushanju fama. Kabari 93 katonyeze katonyeze mushanju fama hoima chenda na mwenda katonyeze mwe fama Kampala igana 5 katonyeze mushanju fama Mbarara chenda na mushanju katonyeze 4 fama Footpoto chenda na 8 katonyeze 8 fama Masindi igana 5 fama Kurichiriza UBC West ohulire nibaganiza UBC West empika huna
Juko. Yo. Check the shopping, man. What's your secret?
Haven't you heard of the parish development model PDM?
Yes, I did, but I thought it was just a talk.
No, Sebatia. It is real. I and a few friends together formed a circle, accessed money from the PDM, invested in a portrait project, and now things are moving.
Juko. I thought I was one of your friends.
You are.
But you left me behind.
I didn't leave you in poverty. What you do, just visit your LC2 chairperson and your parish chief and start the process of economic transformation. Just like that. The parish development model is an initiative from the government of Uganda through the Ministry of Local Government designed to transform all lives of Ugandans for the better. PDM, my parish, my development, my life.
107.3 Kampala, 96.9 Mbale, 95.7 Jinja, 98.6 Soroti. You are all covered.
UBC Butewo.
Yikwa dola wini kune. Asoka muliyo. Atekeri na itesa ibija sensi.
UBC Butewo.
Program My School, a great students program and your answer to education perspective, giving you reason as to why you should pay school fees for your child's education with items like students' talents, thoughts, adventures and skills showcased, leadership skills and all other activities plus concerns in various schools in your locations. Remember that our children are our future generation. Don't miss Program My School. It takes courage, passion, practical engagement, career interest, vision, targets who want to create a thriving economic empire. Entrepreneurs Hub giving you a deep and unique insight into agribusiness, services, ICT and innovation, industrialization and so much more. Entrepreneurs Hub growing your small, medium and large business entity with yours truly, Sandra Kahonde, right here on UBC, Inspiring Uganda.
The International Women's Day was first celebrated in Uganda on 8th March 1984 at State House Entebbe, and since then, this remarkable day has been commemorated and celebrated every year. This year, the national celebrations will highlight the progress women and girls have made in reducing poverty, pursuing their economic empowerment, and contributing to national development. Under the theme, Accelerating Gender Equality Through Women Economic Empowerment, the celebrations will take place on Friday, 8th March 2024 at Bomba Grounds, Caht District in eastern Uganda. Happy Women's Day to strong, intelligent, talented, and simply wonderful women.
UBC, inspiring Uganda.
A very good evening to you once again, and welcome to our second and final edition of News Tonight this Thursday, the 7th day of March 2024. We are coming to you live online and on air from Broadcast House here on Nile Avenue. I am Rukidi Edward Kijanagoba. Now, President Yoweri Museveni has challenged women leaders to preach the message of getting everyone into the money economy instead of spending time politicking. He made the remarks today while addressing the leaders of the National Women's Council and the National Resistance Movement Women's League at State House Entebbe. The president advised the women leaders to encourage people with small pieces of land to adopt the 4-acre model. President Museveni informed the women leaders that apart from commercial agriculture, they can also encourage people to use a Myoga program and small-scale manufacturing like shoe making, tailoring, among others, to get out of poverty. Take a watch.
There are those who say, Museveni, Your Excellency, I want to thank you so much, but I want to bring to your attention that as women of Uganda, the National Women's Council, we are grateful for all the things that you've done to the women. The women you see here in the Women's Council structures are all flag bearers of NRM. And Your Excellency, you are the national chair of the mighty party called NRM. When we were contesting, we started from the village until we made it to the national level and the district level.
Very glad you have come here, and I congratulate you on Women's Day tomorrow. It's very good that many of you support the NRM, and your proposal about the candidature would be discussed by the structures of, you are part of the structures, you have given your opinion. We shall pass those opinions to the other structures, the NEC, National Executive Committee, SEC, and National Conference later, but you have given your opinion and I have noted it. We are going to take a picture. But most importantly, I really want, the other day I gave a speech on Lonyo, Pidan, Oti, Acher. Do the pigs if you want. If you are not a Muslim, you can do poultry. You can do fish farming. This is for the small scale. Intensive agriculture, using a small piece of land to get good money. Apart from agriculture, commercial agriculture with the kibaro, there is the emyoga, the skills of the hand. This is before you talk about the big factories which are brought here by Ugandans, but also by foreigners. So that's the second channel of getting out of poverty. Preaching the gospel, medical, you can be a service provider, medical, and professionals like engineering, and so those are part of service. So that is sector 3. So you as NRM